with carnitine. And it's important that you understand if you're taking valproic acid or any antiretroviral medications, you really want to talk with your doctor about carnitine supplementation. At the very least, I would suggest you talk to your doctor about measuring your carnitine levels to see if those meds are actually depleting or interfering with the production of carnitine. So again, if you're on these types of medications, definitely want to look into that. Now, other things that you might want to consider, I showed you this diagram earlier, and we drew on it. We talked about iron, vitamin C, vitamin B6, vitamin B3 as being critical for the production, the internal biological production of carnitine from the amino acids methionine and lysine. And so there are drugs that deplete these nutrients as well. And so if you're on other medicines that can deplete vitamin C, for example, what depletes vitamin C? Well, one of the most common is steroids. So if you're taking any kind of, actually, let's move this out of the way. If you're taking any kind of prednisone, steroid inhaler, or oral steroids for pain and inflammation, understand that that steroid can deplete your vitamin C. Antacids. So if you're taking, PPIs or over-the-counter antacids like Tagamet, etc., you're going to deplete vitamin C. You're also going to deplete iron. If you're taking tuberculosis drugs and antibiotics, you can deplete vitamin B6. And if you're on diuretics, for example, maybe you're taking a blood pressure pill like furosemide or hydrochlorothiazide, these diuretics will deplete your B vitamins. So you want to also consider not just these medicines, valproic acid and antiretroviral, those directly interfere with carnitine, but you need vitamin C and iron and vitamin B6 and vitamin B3 to produce carnitine. So if you're taking medicines that can impact these particular nutrients, you might also be impacting your carnitine as well. So keep that in mind. Okay, how do we get carnitine in our diet? For the most part, it's in meat, right? Carnitine carnivore, think of it that way. It's in meat. Now, vegetarians are at increased risk of deficiency, but something we also know about vegetarians is they actually absorb carnitine more effectively than non-vegetarians. In part, I think it's just the wisdom of the body saying you're not eating as much, so whatever you do eat, we're going to have a heightened absorption of whatever's there. You can see beef, pork, poultry, fish, A2 dairy. The reason I say A2 is because A2 dairy isn't going to increase the potential risk for inflammation or autoimmune diseases like A1 dairy might. So if you're not familiar with A2 dairy, you might want to check out our crash courses on dairy and learn a little bit more about that. But again, carnitine found mostly in animal products. Now, there's very small amounts in avocado and asparagus, nowhere near as much in these, again, plant-based foods is what you're going to find in meat. But again, vegetarians do have more enhanced absorption. Now, if you are vegan or vegetarian, it is something I do encourage you to check out, is to check out with your doctor whether or not he can measure your carnitine and have that looked at periodically when you go in for your checkups. Again, it's something that's simple to supplement with if you're deficient. Now, the other group that I would say is at a greater risk for deficiency are people following keto diets. And why would people on keto diets have a greater risk for deficiency? Generally speaking, keto diets are very low carbohydrate and very high fat. Now, when we're eating large quantities of fat, what do we need more of? We need more carnitine. Why? Because carnitine is the taxi cab for fat. It's what actually helps transport fat through into the cell mitochondria to generate energy. So if you're relying on fat as your primary source of energy in your diet, as many people today are, there's a lot of folks following keto diets on a regular basis, there is an increased demand for carnitine. And so if you're following like more of a low meat keto style diet, there's I think some diets called keto green Again, if you're not getting enough meat in your diet and you're more heavy plant-based but high fat, you definitely want to consider carnitine as a potential add to your supplement regimen, or getting measured or getting tested for carnitine. Beyond that, if you're eating animal meats on an adequate basis and you don't have GI inflammation, you should be able to absorb it just fine and get enough from your diet. Now, should you supplement? That's the question that everybody asks, right? Should you supplement? Who are the people that maybe should supplement? Well, again, going back to what I've shown you today, you have high blood pressure, maybe you have fatty liver disease, or your triglycerides are high, or your blood sugar levels are high, and you're doing everything right. You're already, to your knowledge, following a really solid diet and doing the right exercise and getting good sleep and sunshine, etc. These are areas where you might potentially want to supplement. If you're trying to recover from workouts more effectively, if you're trying to improve your workout performance, you might want to consider supplement testing or supplementation. Now, I always recommend folks get tested, because the best way to answer the question, should you supplement, is to test yourself. It's get tested so that you know, do you need to supplement? Because if you don't need more, don't, save on supplements, save on your supplement bill. Again, relatively safe doses, 1,000 to 4,000 milligrams a day. There have even been some studies with up to 6,000 milligrams a day with virtually very little to no side effects. And so that's not me saying take 6,000 a day or 4,000 a day. I certainly don't recommend you go high doses of carnitine if you haven't done testing. But if you're looking for a relatively safe amount to take without testing, a lot of research backs up 1,000 to 2,000 milligrams per day is a pretty safe dose. Now, if you're on medications or you're being treated for any types of health conditions, again, it's always important to talk with your doctor, and don't take this as medical advice on how to use your supplements. I'm just trying to give you general guidelines, so keep those things in mind. Additionally, let's talk about the forms of carnitine. So when we're talking about carnitine supplementation, there really are just two main forms. There's L-carnitine, and then there's something called acetyl L-carnitine, as I mentioned earlier, L-car. Now, what's the major difference? Is that this form of carnitine has an acetyl group attached to it. It's acetylated. And why is that important? Because that's what allows it to get through the blood-brain barrier. So if you are taking carnitine, experimenting with carnitine as a supplement, potentially for these things, these reasons down here, to improve mental acuity, possibly to improve your learning capacity, to help with cognitive decline or depression, or improved energy production by your brain, or neuropathy or traumatic brain injuries, acetyl L-carnitine is a preferred form because it gets through the blood-brain barrier. Unlike L-carnitine, your body has to convert L-carnitine to acetyl L-carnitine. So if you're using this type, it's skipping a biochemical step, and it just helps access your brain and your nervous system. Now, you don't necessarily need acetyl L-carnitine if your aim is to affect these different areas. So the regulation of cholesterol, blood pressure, heart maintenance, regulation of blood glucose, exercise performance, weight loss, exercise recovery, muscle soreness, depression, and sperm quality and quantity. There's actually studies showing L-carnitine improves sperm quality and quantity as well. We didn't talk about that so much, but pointed out here. So again, predominantly if you have nervous system goals in mind for carnitine supplementation, use acetylated carnitine or acetyl carnitine. And if that's not your bag, then L-carnitine is something you can use. And so there are cost differences between the two, and so weigh that out. Now, is carnitine toxic? You see, no cases have been reported even at high doses. Now, that being said, caveat, there's always the potential for a person to have an untoward side effect to a supplement. And this is, I've been practicing 23 years, and I've seen this repetitively, that sometimes, even though there's no major research that says somebody is going to have a problem with a particular supplement, everybody's different and everybody's unique. So some of the symptoms that are reported for carnitine. One of the biggest ones is just GI or stomach upset would probably be one of the biggest ones, if anything. And it's a lot of times my thought on this is it's not so much the carnitine that's doing it as it is for a lot of people. It's the capsule that it's in, and they don't do well with that type of capsule, or in a lot of cases, if it's cheap supplements, it's fillers. It's fillers that don't need to be there, that are there, that can create some gastric upset. Now, there's also some studies that report a fishy odor in sweat and in the breath from high-dose supplementation. It maybe sounds kind of gross, but if you have like a rotten fish smell when you're breathing or in your sweat, and you're supplementing with high doses of carnitine, and maybe you're not supplementing to your knowledge with high doses of carnitine, but you're taking like a workout pack, check those ingredients, because if this starts after you're supplementing, then most likely it's when you consume carnitine, it can lead to an elevation in something called TMAO. And so that chemical can give you a fishy smell. So again, that's not fun. Nobody wants to have a fishy smell about themselves. So keep that in mind. If you're taking high doses and that starts to happen, it's very potentially possible this is not the right amount for you to take, and it's just too much. Now, also know that if this does happen to you, somebody asked the question the other day to ask me to talk about basically TMAO, which is a condition, again, where people have in many cases have a genetic defect, so you're making too much of this type of chemical, and so you smell this way all the time. There's some research that shows that vitamin D and other B vitamins, especially folate and vitamin B6, can actually reduce that TMAO. So again, it's complicated. I would say, don't let this fear, this is very rare, don't let this fear stop you from wanting to take carnitine if you're taking it for one of these other reasons and you're deficient in it. But obviously, just be aware that if this happens to you, it's probably a good idea to stop taking it.